All right. Well, good morning, good afternoon, everybody. Happy FSMA Friday. This is Brian Sharp with SafetyChain Software, and really excited to have all of you join us for another edition of FSMA Fridays. This month, we're going to take a look back. We're going to cover 31 days of COVID updates in 31 minutes or less. And the good news is I'm bringing in the big guns to do that. So we'll have Dr. David Acheson join us here in just a moment, but no doubt a lot of change, and we want to keep you up to date on the most important information that affects your businesses out there. So we're going to get right after it. For those of you that might be joining us for the first time, welcome. We're excited to have you. This is the longest standing industry update for food and beverage processors and manufacturers, and really focused at its core around the regulatory changes in and around FSMA. And in recent years, we've also introduced more guests talking about industry trends and best practices. But really where the value, at least in our humble opinion, comes from being able to dig in with the experts at the Acheson Group. So in addition to getting some great content each month, we also have a nice open Q&A forum, and we continue the conversation outside of here and into our LinkedIn group as well. So encourage you to check that out. But we're glad you're here. Before we get moving along, just a couple quick housekeeping items. Try and keep these conversational, so encourage you to ask questions. As I noted, this is usually one of the best perks of hanging out together on these Fridays. We'll probably save the Q&A for the end, so don't be afraid to push your question out when it's top of mind. I'm going to monitor those and try and get to as many of them as we can. If not, the team at TAG are great about taking these answers offline, or they might be very specific or require a bit of research. So again, don't be shy, share your questions, and we'll get to them as much as possible at the end or afterward, one-on-one. You'll notice when you submit them, the panelists are just shown, so you're not publishing that to everybody. So again, we'll be monitoring those behind the scenes. I'll try and knock out the most common question, which is, yes, we are recording, and yes, we will be sharing. A couple of ways you can get to these. One, we'll have a follow-up email for everybody with a link. It'll include both the replay and the deck. But you can also go to our website at SafetyChain.com, go to the Resources tab up on the right-hand side, and there's a drop-down. You'll see FSMA Fridays. Go there, and it is all things FSMA Fridays. Got the whole library, literally hundreds and hundreds of amazing videos and content there for you to access for no cost. So we encourage you to go there and check it out. A lot of great info hanging out in there. If you have any audio issues, Ann Grace on our team, as always, is behind the scenes, so she'll be helping out as best she can. But you do have the option for both phone and web audio, so take advantage of that in case you're getting stuck on that. We all, I think, are dealing with plenty of those on our calls during the weeks. We have hundreds and hundreds of people on here today. I think we're going to be north of probably close to 400 folks, so sometimes the system can get slowed a bit, but that's a good problem. So I want to introduce the man of the hour, the most important, the guy, the reason you're here, Dr. David Acheson. Welcome. It's awesome to have you back.
Thank you, Brian. Pleasure to be with you yet again for COVID-19 updates. So
yeah,
look forward to the next half hour and some good Q&A.
Yeah, absolutely. We know you have been busy, so we're grateful you've been able to carve out some time. Let's start first, though, with something that's always important as well, which is food safety and the whole regulatory aspect. So anything on the FSMA front or regulatory front that your team is watching, hearing, or that you want to make sure everybody in our community is aware of?
Absolutely. As always with all of us that are fundamentally focused on providing a high quality, safe food supply, it's always good to keep our eyes on that ball and not forget about it, despite the challenges of just keeping the businesses running, keeping the doors open, and keeping the supply chain flowing. Very high level, a few things. FDA is coming out of its bunker and definitely doing more inspections than they were. They've always been doing and following up on on for-cause inspections. They've been doing that obviously ever since the pandemic began. But we're starting to see now them talking about going back to routine inspections. So I think we can anticipate we will see more routine inspections, definitely FSMA-centric or just generally food safety-centric. So keep that in mind. The silver lining to that is that they are at least proposing to give companies a heads up that they're coming, which is not their norm for a routine inspection. So that'll help companies just manage an FDA visit on top of everything else that's challenging. Second point is continue if you are importing, if you are anything to do with the foreign supplier verification program, make sure you've got that buttoned up. FDA is absolutely focusing on that, and they're continuing to issue warning letters around failures to be compliant with the foreign supplier verification program. So make sure you're buttoned up on that. Any questions at all, we've done a lot of work on that and can help navigate you through that. And third and final point, which will actually be subject of a FSMA Friday in the near future, is just some updates on the intentional adulteration for small businesses and others. I won't get into the details. Won't steal the thunder of that next one, but again, something that is that is alive and well and growing. So that's pretty much it on FSMA.
Yeah, good reminders. There's a lot of layers here to be focused on. No small task for those that are on the line. We appreciate everything you guys do every day. So thank you for that. And there's a lot of resources. David mentioned we'll be touching on the IA rule in I think next month's FSMA Friday. So a lot more to come on that as well. So with that, David, let's dig in. So I think you committed to give us 31 days of updates in 30 minutes. So let's see what's happening in the world of COVID. I know you guys are helping a lot of customers and seeing a lot of things out there, a lot of change. So I'll let you kind of guide us through this here, and I'll try and keep up.
All right, Brian, that sounds great. Well, what I'm going to do is sort of kick us off by just looking at the state of the pandemic. Where are we on the numbers? Spend a little bit of time talking about the risk matrix, which for those of you who've been with us before, that either I've done with Ben Miller or Ben's done on his own, we've generally guided you through what we're seeing in the trends, because what we're always trying to do is to look for those leading indicators where we kind of know where we've been. We want to know where we're headed. And that is literally the $60 million question with this pandemic, is where we're headed. And I'll try and get into a little bit of that this morning, which obviously is sadly a little speculative, but we'll see what we can do. I want to remind people about the basics and why they continue to be important. So we'll get into that, and then sort of wrap up with a little bit about current challenges and the future of where we're headed and how long we're going to be in this for. So with that, Brian, let's move to the next slide, where we start to get into looking at the state of the pandemic. And I've gone back to basics here, and I just did a screenshot from yesterday's Hopkins daily update US cases, because, you know, even though this is really crude data, and we'll get more into the more subtle components of the tag matrix, which I think is a much more in-depth analysis of where we're going. I don't want to lose sight of this, because this graphic is what a lot of people look at or read about, and people jump on it. And just looking at the shape of this curve and what is going on, and clearly one can see the uptick that we had in the early phases of this back in as it came on board. It got worse in March and April. We flattened out a little bit, we started to slow down, and then boom, we took off again in June, and it went up at least as fast as it was doing the first time, and it went twice as high. One of the reasons for showing this is, and I think this may be just sort of David, it's just me, but I see a little cause for optimism in the last couple of weeks, and you only have to look at the right-hand side of that to see why I say that. You know, is that truly a drop in cases? Is it because we're testing less, not more? I don't know, but I feel that the world is watching this number, and the world is looking at the US, and it's impacting us in every which way, economically, personally, travel, you name it. Americans aren't welcome in most countries from a COVID perspective. So this sort of overall trend is an important one just to look at. And my message here is I'm encouraged that we kind of now doing the right thing again, I hope. But let me move on, because it's not all equal. Let's go to the next slide. This is the same data but it's New York. It's New York State, and my message here is like, wow, look at that hit early on. It was in the news. It was constant. New York was struggling. They got on top of it. They knocked it down, and look at what New York has done. This is as of yesterday on daily cases, and New York is doing a lot of testing. They are looking, but they're not finding it. Now this looks nothing like the previous curve. So let's go to the next slide, Brian, which is the total contrast, California. And apologies to anybody who lives in California, because I know that's what a SafetyChain is. So sorry, guys, but
it's the truth,
you're not doing so well.
No.
So as I look at this, and we try as an industry, as a food industry, looking at, okay, so what are we learning from this? What can we discern from what's going on? And while we might look at the country as a whole and say, well, collectively, maybe we're starting to turn a corner. But clearly, on a state-by-state basis, we've got states that got burnt, have controlled it, and we've got states that missed that early bump. California did not have that early bump, but we're getting hit now. And my own home state of Montana, where I live, is looking a little bit like this. Thankfully, the numbers aren't nearly as high, but the trend is very similar. So we got learnings to go on. So my message fundamentally from these is we're not out of it yet by any means. And yet we need to try to figure out where are we going. So let's go to the next slide, Brian, which gets a little bit into the tag matrix. And I have to give Ben Miller on my team all the credit for doing this. He is the brains behind this, and others on the team who helped pull it all together. But I know you've seen a graph like this before, but let me just quickly explain what we're looking at here. This is a compilation of different bits of information. And the brown line that's running across the graph is essentially the number of tests that are being done per 100,000 population. And across the bottom, and I know it's a little hard to read because there's a lot of data on here, but on the bottom axis are all the states. So we got them just ranked across based on the numbers of tests that they are doing. And to my point, you will see that New York is kind of over there on the right-hand side. It's about 4 in, which tracks back to what I was saying. And California isn't far away. So California and New York are doing pretty much the same amount of testing. So that tells you that, hey, there's a real difference with the numbers of cases in those two geographic locations. The other take homes from this is if we look at the blue bars, which represent the total positive rate. So this is how many of the tests that we're doing, what's the percentage that are positive? And the higher the blue bar, the higher the percent positive rate. And for several weeks, Arizona were leading the pack in terms of the positivity rate. For the first time, Mississippi took over ahead of the pack with a 24% positivity rate, and Arizona actually went down. But if we look at this, say, okay, what are the take homes? Those states where we're more than 10%, we at TAG consider them to be kind of on fire. They really are the hot spots. And a lot of the quarantining and talk about where the hotspots are driven by this sort of matrix assimilation data. The third message from this figure up on the screen at the moment is the red bars, and the red bars represent percent change. So these are the changes since last week, and we do this every week. So what you can see there is that we've got quite a few where it's gone up just a little bit, but then we've got 4 or 5 where the red bars are pretty high. Kansas, Missouri, Mississippi. So this graphic has a lot of data on it, and it starts to, as you look at this week over week, it begins to allow you to see, okay, which states are trending up, which are the ones that are doing lots of testing, looking really hard, and despite that are not seeing very much, or despite that or because of that, they're seeing a bunch of cases. Let's go to the next one, Brian. In this one and the next slide, I've gone a bit historical on us. And I know Ben has shown these slides before, but essentially what we've got here is our matrix, looking at it through a different lens. This data is from May, so I went back to May 18th, and on this graphic across the bottom axis is what we call our outbreak index. When we don't have time to get into what the details are, but that's a multifactorial index that really sort of looks at how well are you doing, how bad is it in a state, and each circle represents a different state. The vertical axis is the social distancing monitor that we use to look at, well, how far are people staying apart. And what I want people to take home from this is, as you look at May, and we're going back 6 weeks, we generally had the bulk of those red circles are over on the left-hand side of the figure. We'd got quite a few that were up in that top green quadrant, which basically means the outbreak index was pretty low and people were socially distancing pretty well. The place to avoid is that red square on the bottom right. So this was May, this was 6 weeks ago. Let's look at last week. Next slide, Brian. And not so good.
Wow.
There's a big contrast. So this is how we've slipped in 6 weeks. Social distancing has, as you look at that, it's got really tight in terms of pretty much looking at the vertical axis. All of those circles are within a tight area, which basically is saying, yeah, people are still social distancing somewhat, but across the country, it's pretty much the same wherever we are, whether we've got super hot spots or cool spots. And obviously, we've seen this migration of multiple states over there into what we consider the high-risk zone, is that red zone. And this becomes predictive because you can actually follow those circles. If you do this week over week over week, you see them migrating across the chart. The good news, and there's not much, but the good news is that the one state that's going back the other way now is Texas. We saw Texas shift away from red and towards yellow. So obviously there's lots going on, there's lots of cases, there's lots of things we have to worry about. We absolutely cannot relax for 1 second. So let's go to our next slide, Brian, which gets to you cannot relax for 1 second. The last several slides have given you a flavor of what we're dealing with, and some of this is very tag centric, like those matrix slides. Some of it is just publicly available, like the Hopkins data. But it reminds us, don't forget the basics. And the key message here is we're all connected with food and beverage for the most part, or industry in some way. And the food industry has got really good at helping to manage the risk in the plants. And we have to constantly remember that these lessons, the pyramid that we've got here around how to protect ourselves, is just as important when we're not at work as when we are at work. You know, if you're sick, stay home. If you're not well, if you've had contact, then self-quarantine. Putting in the preventive measures, the social distancing, the masks, et cetera, ensuring a clean environment. And I'm not going to go, we don't have time to go into all of this in detail, but constantly keeping in mind, this is just, it's not a one size fits all. It's not a socially distance and we'll be fine. Wear a mask and we'll be fine. Wash my hands and I'll be fine. No, it's a combination of all of these risk mitigation strategies that builds the pyramid that collectively starts to control the risks. So key message here is constantly reinforce these basics around it's like fundamental food safety. We cannot forget our GMPs. We cannot forget to wash our hands. etc. And if we're in the restaurant industry, we cannot forget we shouldn't be coming to work if we have diarrhea and vomiting. These are the basics of continuing to try to push this curve down, and it's probably more important today outside of work than inside of work, because people know what to do when they're at work. They've been told, and they get it, and there's oversight,
Yeah.
and help and support and education. At home, not so much. So the basics are important, and I couldn't not mention the criticality of that in mind. So let's go to our next slide, which gets sort of the last couple of thoughts here is, well, what are our current challenges? And there are many, but I've just sort of pulled out a few here that I think are important, and ones that we're getting questions about on many times a day. First of all, how to use testing. The history of testing for COVID has taken a roller coaster, I would say, kind of ride. When the virus first hit, the pandemic took off, tests were reserved for those that were really sick. There simply were not enough tests to go around. Test volumes increased. There were more tests out there. And so we had more testing done, and to some extent that drove up the numbers, because we began to realize, wow, there are people out there who have this virus and don't have symptoms. So we began to realize a couple of months ago that there was a significant number of asymptomatic cases, which is why there was this big shift towards masks actually really do work, and they really can protect spread of the virus, particularly if you are excreting the virus and you don't even know it. Then wearing a mask will help protect everybody else. We got into this debate, okay, which test? Should I look for the virus itself, or should I look for the antibody? And those debates are still out there. And if you're going to be testing, make sure, as we've said before on FSMA Fridays, that you know what the test means and you know what you're going to do with the data. There has been a shift in recent weeks around doing more testing, particularly in the food industry, and a couple of large companies have gone public and said, we're going to do a lot more testing. And we know when you do that, you will find asymptomatic positives. The other important thing about testing is what we've learned in the last month or so is that when you get infected with the virus, whether you're symptomatic or not, you carry the virus in you for quite some time. Some people can carry it for weeks. And CDC believe that you are infectious for about 10 days after the onset of symptoms. And after that, unless you are severely immune compromised or you've been seriously ill with the virus, you are likely no longer infectious, but you may still be carrying the virus. So if you get tested 3 weeks out after your symptoms have resolved, you may still be virus positive. And people are getting caught here, because we were in this phase of, okay, somebody's tested positive, and this was CDC guidance. This was like, yeah, we need two negative tests to come back to work. And I'm sure many of you identify with this, but I've had numerous conversations with companies said, you know, we tested George and 3 times and he's been positive each time. He's not had symptoms for 2 weeks. What do we do? And, you know, we bring him back every 3 days and he keeps being positive and he's fed up and he wants to come back to work and he feels fine. And you know, the dogma was, well, if he's positive, he should stay out. Mid-July, CDC announced basically saying, don't use tests to bring people back. Work on resolution of symptoms. And just to remind everybody, the guidance there is 10 days since the onset of symptoms, number 1, and 24 hours with no fever off medications. And that's a change. It used to be 72 hours. Now it's 24 hours. So 10 days since the onset of symptoms and no fever for 24 hours off medication and resolving symptoms. Got to have all 3. And that's the current CDC recommendation to bring people back. Don't rely on the tests, because we're finding that people will test positive, but the CDC don't actually believe they represent a risk. So testing remains complex. It remains challenging. And it is increasingly being used to detect asymptomatic cases, particularly in certain parts of the country. So we are seeing more of that. And obviously, again, if you're a business and you're thinking about getting into testing, do consider the fact that you will probably find asymptomatic cases and look at all of that and how you're going to manage it. Second big challenge, travel. We've got multiple states putting in quarantine requirements. Typically, the requirements are on a state-by-state level to state residents. If you have traveled to any of the following states, you need to self-quarantine for 14 days when you come back into home state. We've got 50 different ways of doing this, and we've got 50 different levels of oversight. It is, you know, it's very interesting the way this is managed and the way it's policed. I was talking to, just anecdotally here, I was talking to somebody up in Canada last week who is up there, US person, got family up there, went up and is quarantining up there. And he was reminded as he crossed the border into Canada by the Canadian officials that, yeah, you know, you can come into our country, but you have to self-quarantine for 2 weeks. And we will be checking on you. And if we find you are not at the address that you have stated, you face a $1 million Canadian fine. No questions. You'll get a $1 million fine. That was impactful. This guy said, you know, I went there and I closed the door and I stayed put. So, you know, we're not quite operating at that level in the US, but the Canadians are serious about this. And, you know, interestingly, they kept things under control. So, but day to day for companies, folk are going on vacation. What do I do? Should I keep that person out? And we've got some comprehensive information to help people manage that. Should they need it, reach out to us, because it's not just where did you go, it's how did you get there, who did you go with, what did you do when you're there. It's not as simple as geography. Third key challenge, many companies are saying, can we open our offices safely? How do we do that? What should we do? Lots of advice again on that as you're thinking about this. And I think a number of companies have reached the point to say, well, work from home works pretty good for, you know, 80% of our workforce, but we've got people who are trying to work from home and it's just not, it's not working for whatever reason. Family or kids or pets or internet connectivity, you name it. There's a reason where people are really struggling with this, and companies want to start to try to bring folk back. Maybe 10, 15, 20% of the workforce. How do you do that safely? There are ways to do it safely. We've got the impact of planning for return to school. Obviously, a very hot potato in terms of discussion. And the media is all over this, and you know, kids don't get sick, kids do get sick, kids don't transmit, kids do transmit. It's truly all over the map in terms of what we're hearing. My opinion here is that, yeah, kids can get COVID. Generally, epidemiologically, kids do not get as sick as adults. We know that. Younger people don't get as sick as adults, but yeah, they can carry the virus. There's certainly a risk that they could spread it, but we're not seeing rampant spread amongst children. And as CDC have articulated, one has to look at the greater good. COVID pandemic is one thing we're trying to control, but there's many, many, many other factors to think about in terms of children and their overall well-being and mental and physical health. And finally, colleges as a challenge. We've started to do quite a bit of work with colleges, helping them figure out how to bring students back safely. And all of this, the reason I mentioned schools and colleges is it impacts our workforce with people who are trying to work and they've got to think about daycare and all of that. There's all very impactful in managing all the risks. So let's go to the next slide, which I think is my sort of kind of final thinking here. Can we predict the trends? Sadly, not very well. I think when we looked at this at TAG, I felt that once the country opened up in June, we were going to see an increase, and we did. I didn't think it would be as big as it was, and it was clearly dramatic and significant. David, and this is me, I'm cautiously optimistic that maybe we're starting to see this flatten off. And that's perhaps, as I say, me being more of an optimist. Big question, will we see a surge in the fall? I don't know. I was feeling pretty good about this, that we would not, because Australia, who were in their winter, were doing well, and all of a sudden they blew up. I don't know why. I don't know whether that was related to the weather. This virus doesn't like sunshine. It dies off. We're all outside doing outdoor things. We know the virus spreads more indoors. We know it spreads in tight quarters. It's going to die off less quickly when the temperatures drop and we get cloudy days. So we may well see a little surge in the fall, which is going to be then further potentially influenced by what we do with schools and colleges. So I think we have to anticipate that we're in this for a while longer. Vaccine development, lots of talk about this 30,000 person study being undertaken. That's an important step. I'm not particularly bullish that vaccines will be with us anytime in the immediate future, because one has to show they work, and more importantly, one has to show they're safe. And I think the American public are skittish about vaccines, given that a vaccine is given to a healthy person to keep them healthy, and side effects are largely unacceptable. Effective treatments, lots of things cooking there. Again, nothing that's looked completely effective yet. And I think it's going to depend on the drug and the time you give it. Some cause for hope in some with some of these treatments, like remdesivir and hydroxychloroquine, but it's clearly not the panacea, because there's certainly plenty of studies to say that they don't work, but they typically have been used later in the disease, and there's a question whether it might be more effective earlier. And then the last point that I want to make is just, we're all in this, and we've been in this since February, and there is an emotional and economic burden to this for everybody, for those trying to manage this, for those in it, for the workers. And I think we have to constantly remember that our workforce needs that support. They need that help. We need to be sympathetic to the fact that this is not just about keeping our business running. It's about recognizing the emotional and economic hardship and challenges that it's putting on every single family in the United States. And looking after that side of our workforce, frankly, is just as important as protecting them from spread of the disease used through cleaning and mask usage. It truly is. It's a combination of many factors. So with that, Brian, I think we got one more slide just to remind people that we're here to support. There we go. We are changing. Advice is changing. We are recommending things on a daily basis. We've got updates frequently. There's our website. Feel free to reach out. And with that, Brian, that's my update. So let's see if we can get a few questions squeezed in.
Thank you so much. Yeah, and I know we're at the bottom of the hour, so again, we'll try and get to as many questions here, units as we carry over. We'll take the rest offline. But just while we have everybody, I just want to thank you. That was helpful, insightful, hopefully starting to be a bit optimistic. And but you guys have just been great leaders and supporters here throughout all of this. So we really appreciate all you've been helping the community with. That link there is a really great resource. We'll include that in our follow-up as well, but we highly recommend it. We use it regularly as well. And I appreciate what you said at the end there about just taking care of people right now. There's a lot going on. Questions-wise, we're all over the board, David, so I'm going to try and cover a little of everything. No pun intended. I'll start with the covering. I think there's some questions just about face covering, and there's a lot of different ones. I'll generalize the question and just say, inside the plant on the floor, what are the best practices right now that you're seeing or recommending for workers?
Yeah, I mean, what we've learned about face coverings is they're not a panacea. They don't work 100%. Face coverings are certainly have an effect if you are asymptomatic positive, so you're carrying the virus and you're wearing a face covering and it's catching droplets and the moisture that's coming out of your mouth as you breathe, cough, and talk. That will help protect your coworkers. Not 100%, but it definitely is protective. If you are fit and well, you don't have the virus and wearing a face covering, it's not going to protect you 100% from getting the virus. It'll reduce the likelihood somewhat, but
Mm-hmm.
it's not going to protect you 100%. A lot of the debate around face coverings, and it runs the spectrum, Brian, from somewhat effective through very effective, where you've got properly
Mm-hmm.
fitted N95s at the top end, and you've got a bandana over your nose and mouth at the lower end, and it's everything in between. My bottom line on this is any kind of face covering will incrementally reduce the risk. None of them are absolute. And to my earlier point with the pyramid, we have to use face coverings in the context of the overall every other control that we're doing. One point about them is obviously we're in the midst of summer. They can be hot, they can be oppressive, they can be difficult. And I think that one has to be cognizant of the fact that we don't want people getting overheated with a face covering. And you got to do a case by case. You really do. You got to recognize that there's multiple factors here. But face coverings, despite what was said in the early days, really do seem to reduce the risk. But it's incremental, and it's part of a comprehensive risk reduction strategy.
Right. Good point. And I think you've been consistent with that. There's nuance to all of this, right? And that's great. A couple of questions that are coming. Again, I'm trying to cover as much as I can here about testing for when you have the asymptomatic people, right? So there's pretty clear process and protocols when there's symptoms or they test positive initially, but the ones that are testing positive that are asymptomatic, can you either clarify or restate kind of what your recommended approach is there about letting them back in or how to handle them getting back to work?
Yeah, absolutely. Now, and as we do more testing, we're finding asymptomatic positives. And I think the thing to remember about an asymptomatic positive person is, and it's an important differentiator, is are they asymptomatic because they are in the very early phases of the disease, and in fact are what we call pre-symptomatic, which means they've got the virus, they haven't got sick yet, but they will get sick. And as we talked before, we know that typically for 48 hours before you get sick, you're secreting the virus and can infect others. So that's a sort of a pre-symptomatic group, but they're infected, they can spread it, but they feel fine, but they will get sick. The other group is those who carry the virus and are able to spread it, but are never going to get sick, or they're going to get such a minor illness they don't even notice it, which is sort of the true asymptomatic stay asymptomatic. My recommendation on that is if you find somebody who feels fine and they're asymptomatic, you don't know where they are on that spectrum. You don't know whether they've had the virus for 1 day or 6. So the standard recommendation is an asymptomatic positive is you quarantine them. You have to assume that they're in that pre-symptomatic phase and they can infect others. Quarantine them means get them out of the workforce. And in terms of bringing them back, ideally wait 14 days. That's still the recommendation. If they get symptoms, then it starts the 10-day clock at that point. 10 days since symptoms began, coming back with 24 hours, no fever, and resolving symptoms, then they can come back. The CDC recommendation, as I mentioned earlier, is don't test them to come back because they may still be positive. Wait your 14 days, don't retest. Then if they haven't got symptoms, they can come back. If you're trying to get people back sooner because you're under workforce pressure to do that, talk to us. That is very case by case, and there are ways to try to do that as safely as possible. But I don't want to just give generic advice on that. There are ways to handle it, but that is more of a one-on-one conversation.
Good point. No, but helpful guidance there, but great point there at the end. There is a lot of case by case here. Last question, and then we'll work to take the rest of these individually. And again, for those asking about the content here, yes, we'll be sharing the link and the slides. Some great data in here that you're going to probably want to share internally. So we certainly encourage that. But going back to your graph around the states and what you guys have been collecting there and the hot spots, we're starting to see some customers allow internal travel right amongst sites. So the question here is a good one that was asked about if you have an employee traveling from a non-hotspot state to a hotspot, what's your recommendation when they come back? So this is really thinking proactively here.
Yeah, and I think if you're doing that, the first thing I'd recommend is plan your strategy, educate, inform, and assist that traveler to be safe. However they're traveling, if it's by car or by plane, where they're staying, what they're doing, how to minimize risk, number one. I think that's a very important upfront part of education, so reduce the risk. When they come back, and again, a general recommendation, but every company is a little different, is, I think it's important that they have a conversation with HR. Where did you go? What did you wind up doing? Not in exquisite detail, but what you're trying to do through a series of really a conversation with the traveler is have they exposed themselves to super high risk condition? If they have, then one leans towards saying, well, we need to have you work from home for 2 weeks while we make sure you don't get symptoms. If based on that assessment you feel, no, this is a very low risk situation, even though they went to a hotspot. And I want to emphasize that again, because just because you go to a geographic hotspot does not mean that you've necessarily put yourself in a high risk situation. The way different state jurisdictions are managing this is they're doing it purely on geography. If you've traveled to a high risk state, you have to self quarantine for 2 weeks. It's a black and white geographic decision. For companies, you don't have to be as black and white as that. And you shouldn't be, in my opinion. You should look at what this person did, how they got there, who they went with, where they traveled, and make a case-by-case decision using a template and using a sort of a risk assessment type approach. And again, that's something that if you want more thoughts on how to structure that, then do reach out to us at TAG, because we've done that for many companies in helping them construct a travel policy guideline, both upfront protection and what to do with travelers when they come back.
Very good. Very good. Excellent. Well, listen, Dr. Acheson, thank you so much. It's great to have you, partner. Great to have you as a resource, and we really appreciate all the help you've been providing everyone. So appreciate everything you pulled together for us today.
Absolutely, Brian. Good to be part of FSMA Friday, as always. And thanks to all of those who joined us. And if you've got follow-up questions, you know how to reach us.
Yep, absolutely. If you want to head over, there is a LinkedIn group for FSMA Fridays. You can ask some questions and keep the conversation going there. We'll be back on August 28th. Thank you, everybody. Take care of each other. Be safe. Thanks for joining today, and we'll see you next month.